Hello, good afternoon, everybody. I'm Dr. Himanshu Mathur on behalf of Jaipur Rehab. I'm here. Welcome all of you. कैसे हैं आप लोग? I suppose you people are very good. Enjoying your Sundays. Welcome all of you. Just a second. Yeah. So am I. Sorry, मैंने आप लोगों को संडे को डिस्टर्ब कर दिया यार आप लोगों को with this topic. Although there are a few people who have come live. Thank you so much. इज्जत बचा ली आप लोगों ने लाइव आकर के. मुझे लग रहा था आज कोई नहीं आएगा लाइव, but that's okay. That's great. So without wasting any more time, let us start with our today's session of interaction of forces and muscles. Okay, muscle interaction, and let us know about the forces which are acting upon. Okay, chaliye ji. Without wasting any more time, I shall start with this. Just a second. Okay. Just a second. Okay, I think that must be visible to you people now. So we have to start with the muscle interaction, and we must know about the forces that must be acting around the whole this cervical spine. बिफोर दिस मैं एक छोटा सा टॉपिक आप लोगों को वापस से रिवाइज करवाना चाहूंगा, जो हम लोग बहुत पहले से बहुत बार बात कर चुके हैं जिस चीज के बारे में. वो है छोटी सी बात, वापस से एक बार, हर जॉइंट को मूव करने के लिए एक फोर्स की जरूरत होती है, राइट? देयर हैज टू बी सम फोर्सेस व्हिच आर कैरिंग आउट मूवमेंट एट योर एवरी जॉइंट इन द ह्यूमन बॉडी. All the movements that are occurring in the human body are angular motions, right? और एंगुलर मोशन को फोर्सिबली मूव कराने के लिए जो फोर्स चाहिए उसे हम एंगुलर फोर्स कहते हैं. और एंगुलर फोर्स को हम एक शब्द में अगर बताना चाहें तो दे आर टॉर्क. दे आर कॉल्ड टॉर्क. ओके, टॉर्क इज द एंगुलर फोर्स. ओके, टॉर्क. ये बेसिक कंसेप्ट पूरी क्लास के दौरान, आज के पूरे सेशन के दौरान आप प्लीज 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 याद रखिएगा, क्योंकि अगर ये याद नहीं रखा तो हम शायद उस लेवल पे पहुंच ही नहीं पाएंगे जहां तक मैं आपको ले जाना चाहता हूं आज, राइट? टॉर्क का फॉर्मूला क्या कहता है? टॉर्क इज इक्वल्स टू फोर्स इनटू मोमेंटम. ओके, नाउ दिस फोर्स इज द मसल फोर्स. ठीक है, अगर मैं मूवमेंट की बात कर रहा हूं तो इट हैज टू बी मसल फोर्स. वो फोर्स जो कि मसल एक्सर्ट करती है, दैट इज द मसल फोर्स. ठीक है, मोमेंट आर्म is the perpendicular distance of the insertion of that particular muscle from the axis of rotation. जहां से रोटेशन हो रहा है, मान लो C5 C6 से हो रहा है, मान लो C6 C7 को अगर मैं एक्सिस ऑफ रोटेशन मान रहा हूं अपनी, तो वहां से परपेंडिकुलर डिस्टेंस उस एरिया का जहां तक वो मसल जाकर के इंसर्ट हो रही है. क्योंकि हम लोग हमेशा से बात करते आए हैं ना कि मसल एक्ट्स फ्रॉम इट्स इंसर्शन, तो एफर्ट का एप्लीकेशन भी इंसर्शन के पॉइंट से ही होगा. ठीक है, तो वो मसल जहां जाकर के इंसर्ट कर रही है उसका डिस्टेंस एक्सिस ऑफ रोटेशन से जो होगा वो उसको हम कहेंगे मोमेंट आर्म, द परपेंडिकुलर डिस्टेंस. ठीक है, इसीलिए हम हमेशा बात करते हैं, अगर आप ये फॉर्मूला देख रहे हो, टॉर्क इज इक्वल्स टू फोर्स इनटू मोमेंट आर्म, तो इससे मैं बड़ी इजीली कह सकता हूं दैट टॉर्क इज डायरेक्टली प्रोपोर्शनल टू मोमेंट आर्म. ठीक है ना, मतलब अगर मोमेंटम ज्यादा हुआ तो टॉर्क भी हमेशा ज्यादा होगा. मतलब वो मसल जो एक्सिस ऑफ रोटेशन से दूर है वो हमेशा ज्यादा टॉर्क प्रोड्यूस करेगी, और वो मसल जो एक्सिस ऑफ रोटेशन के पास है तो वो हमेशा कम टॉर्क प्रोड्यूस करेगी. इसका मतलब सीधे सीधे शब्दों में ये कि वो मसल जो दूर लोकेटेड है, मतलब ज्यादा सुपरफिशियली लोकेटेड है स्पाइन से, मतलब ज्यादा सुपरफिशियली पैल्पेबल मसल है, बहुत ऊपर ऊपर लोकेटेड है, इसका मतलब एक्सिस ऑफ रोटेशन से दूर है, एक्सिस ऑफ रोटेशन से दूर है अगर वो मसल, तो उसका मतलब ये कि वो मसल का मोमेंटम ज्यादा है। मोमेंटम मसल का ज्यादा है, इसका मतलब वो मसल ज्यादा टॉर्क प्रोड्यूस करेगी। ज्यादा टॉर्क प्रोड्यूस करेगी तो वो उतनी ही एफिशिएंट मोबिलाइजर होगी, राइट? सो द मसल which are located superficially are very good mobilizers, and the muscles which are located deeply are good stabilizers always. Okay, so always remember that. अब ये क्या कहते हैं, एक बार ये भी जान लेते हैं अपन फटाफट से, ठीक है ना? द मसल्स ऑफ द क्रेनियोसर्वाइकल रीजन सर्व टू रोल्स प्राइमरली। इधर वन इज दी स्टेबिलाइजिंग एक्शन, मतलब मैंने सिर को सीधा होल्ड कर रखा है, क्योंकि हमारे पास यहाँ पे चेहरे का जो वजन है, जो मेरे हेड का, जो मेरे फेस का वेट है, वो मुझे हमेशा नीचे ड्रॉप कराने में लगा रहता है। क्यों? क्योंकि बहुत हैवी सा स्ट्रक्चर है स्कल का, जो कि एंटीरियरली लोकेटेड है। एंटीरियरली लोकेटेड है तो इट विल tend my neck to fall anteriorly down. If it will tend my neck to fall anteriorly down, तो there has to be strong forces posteriorly जो कि इसको पुल करके रखें, ठीक है? तो इसके दो बेसिकली एक्शंस हम लोगों ने आज तक नोटिस किए हैं, जो मसल्स हमें मिलती हैं हमेशा नेक के अराउंड। तो वन इज टू होल्ड द हेड अपराइट अगेंस्ट दी ग्रेविटी, जो कि मैंने बताया वो गिरता नहीं है, मेरा सर हमेशा स्ट्रेट रहता है। तो जो नेक को स्ट्रेट या हेड को स्ट्रेट रखने का काम है, वो एक मसल्स का काम होता है। और टू अलाइन द नेक इन इनफाइनाइट पोजिशन, ओके, इनफाइनाइट पोजिशन ऑफ द हेड इन द स्पेस का जो अलाइनमेंट होता है, मेरा सिर ऐसे ऐसे नहीं घूमता रहता है हमेशा, है ना, लेकिन मेरा हेड स्ट्रेट रहता है। अगर मैं सीधा भी खड़ा हूं, ऑल्दो नीचे नहीं गिर रहा, तो मेरा सिर ऐसे भी नहीं जाता, पीछे नहीं जाता, ऐसे भी नहीं जाता, ऐसे भी नहीं जाता है। देयर इज अ डेफिनेट पोजिशन ऑफ माई हेड in the whole space, in this whole room there is a definite position of my head along with the walls, along with the atmosphere here, ठीक है ना? मेरे लैपटॉप के सामने बिल्कुल एक स्ट्रेट पोजीशन है मेरे हेड की, बार बार ऐसे ऐसे नहीं जा रहा है। तो वो किसका काम है? मसल्स का काम, राइट? नाउ एवरीबडी ऑफ अस नो वेरी वेल that the line of gravity, this is the line of gravity that we are talking about. This line of gravity falls anterior to the axis of rotation of the spine. cervical spine के हमेशा anterior होती है, ठीक है ना? बिकॉज द सेंटर ऑफ ग्रेविटी और सेंटर ऑफ मास ऑफ द हेड इज लोकेटेड क्वाइट एंटीरियर है, ठीक है ना? यहाँ पे एंटीरियरली लोकेटेड होता है, इसी वजह से लाइन ऑफ ग्रेविटी भी एंटीरियरली पास होती है हमेशा यहाँ से, ठीक है? अगर ये एंटीरियरली पास होती रहेगी तो ये हमेशा एक ऐसा डाउनवर्ड फोर्स एक्सर्ट कराती रहेगी, ठीक है ना? दिस इज योर एक्सटर्नल लोड। द लोड ऑफ द वेट और द लोड ऑफ हेड इज ऑलवेज एन एक्सटर्नल लोड, ठीक है ना? So this external load is counteracted by the effort or the contraction or the force of contraction of the extensor group of muscles, ठीक है ना? तो ये हमेशा याद रखिएगा इस चीज को। Now the line of gravity passes in a normal standing position, passes anterior to the axis of rotation in the cervical spine, producing a flexion moment, ठीक है ना? हमने ये दिखा दिया एरो, इसका मतलब नेचुरली फिजियोलॉजिकली एक फ्लेक्शन मोमेंट एड हमेशा रहता है हमारे पास। एक गिरने वाला फ्लेक्शन जो मोमेंट होता है वो हमेशा अवेलेबल होता है हमारे पास, ठीक है ना? और उसी को काउंटर करता है द एक्सटेंशन मोमेंट विच इज बीइंग काउंटरैक्टेड बाय द एक्सटेंसर्स ऑफ द मसल, ठीक है? सो ये एक एक्शन होता है कंबाइंड पुल, जो कि लिखा है उन्होंने, कैपिटल एक्सटेंसर्स एंड दी सर्वाइकल एक्सटेंसर्स का। तो ये हमेशा हमारे पास एक अवेलेबल चीज होती है, राइट? Now coming on to the exact things related to our posterior musculature. तो जो सबसे पहली मसल हम लोग स्टडी करते हैं, वो मसल जो सबसे पहली हम लोग देखते हैं यहाँ पे, that muscle is your trapezius. Rather to be more specific, let me write this thing. It is upper trapezius, ठीक है? अपर ट्रेपीजियस के बारे में आप लोग बहुत अच्छी तरह से जानते हैं। अगर जानते हैं तो फटाफट से मुझे इसका इंसर्शन लिख के बताओ, फटाफट। You have 10 seconds. Write down in your comment box, please write down the insertion of the upper trapezius muscle, not origin. I'm not asking about origin. Write the insertion of the upper trapezius muscle. Come on, jaldi. You have 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go. Do we have it here? Yes, we have. There are few people जिन्होंने लिखा है medial upper border of clavicle. Yes, it is right. Upper portion of the spine of scapula. Yes, this is also right. One more. एक और रह गया. क्या रह गया एक और? There is one more insertion of the upper trapezius muscle. There is one more. Come on. चलो हम पढ़ने की कोशिश करते हैं, हम जानने की कोशिश करते हैं कि क्या हो सकते हैं. ठीक है, अब कमाल की बात ये है that मैं एक पिक्चर बना देता हूं आपके यहीं पे. If this is the posterior aspect of your, please pardon my drawing, like this. So it takes its origin from here to here, right? From here to here, right? It is a muscle which originates like this. ठीक है, और इसीलिए इसके जो middle fibers होते हैं, it takes its origin like this. Lower fibers होते हैं, it takes its origin like this. So it forms like this. It forms a trapezium like this. ठीक है ना? Trapezium is a geometrical figure. This whole forms like this. ठीक है ना? Okay, tip of acromion, spine of scapula. Good. Answers are coming. Very good. So eventually इसका काम क्या होता है? इसका काम होता है, अगर मैं ओपन काइनेमैटिक चेन में बात करूं तो जो अल्टीमेटली इट इज अ मसल ऑफ शोल्डर. ठीक है ना? तो शोल्डर की जो शोल्डर पे जो जब ये अटैचमेंट लेती है अलग अलग जगह, चाहे वो स्पाइन ऑफ स्कैपुला हो, चाहे वो अक्रोमियन हो, चाहे वो क्लैविकल हो, तो व्हाट इट डज इज इट एलिवेट्स द शोल्डर इन दिस मैनर. ठीक है ना? जब ये नॉर्मली वर्क करेगी इन एन ओपन काइनेमैटिक चेन, तो ये हमेशा शोल्डर को लिफ्ट करेगी ऐसे. और इफ इन केस अगर मैं शोल्डर को पकड़ लूं यहाँ से, अगर मैं शोल्डर को पकड़ लेता हूं और फिर मैं कॉन्ट्रैक्शन करता हूं, तो शोल्डर तो लिफ्ट नहीं कर पाएगी. तो शोल्डर लिफ्ट नहीं कर पाएगी तो ये अपने दूसरे एंड से एक्ट करना शुरू करेगी. और जब ये दूसरे एंड से एक्ट करेगी तो इट विल कॉज एक्सटेंशन ऑफ द सर्वाइकल स्पाइन एंड द हेड, ऑफ कोर्स, क्योंकि न्यूक्लियर लाइन से स्टार्ट होती है. तो इट कवर्स योर C0 C1 जॉइंट एज वेल. तो ये हेड का एक्सटेंशन भी कराएगी. अलोंग विद दैट इट विल आल्सो कॉज एक्सटेंशन एट द सर्वाइकल स्पाइन. Correct. So in this case, it can be considered as a extensor of cervical spine and your head. ठीक है ना? C0 C1 C1 C2 and rest of the other cervical spine. अब सबसे कमाल बात इस मसल के बारे में क्या है कि ये मसल बहुत ही सुपीरियरली, यानी कि बहुत ही सुपरफिशियली लोकेटेड होती है. अभी हमने पिछली साइड में एक कंसेप्ट पढ़ा था, अगर सुपरफिशियली लोकेटेड मसल है तो उस मसल का मोमेंटम हमेशा ज्यादा है. अगर सुपरफिशियली लोकेटेड मसल का मोमेंटम ज्यादा है तो वो टॉर्क भी ज्यादा जनरेट करेगी. अगर वो टॉर्क भी ज्यादा जनरेट करेगी तो ज्यादा टॉर्क जनरेट करने वाली जो मसल होती है, इट इज ऑलवेज अ गुड मोबिलाइजर. ओके, इट इज नॉट अ स्टेबिलाइजिंग मसल, इट इज अ बिग मसल विद अ लार्जर क्रॉस सेक्शनल एरिया. अगर बड़ी मसल है, क्रॉस सेक्शनल एरिया ज्यादा है, मोमेंटम ज्यादा है सेजाइटल प्लेन में, ठीक है, अगर ये सारी चीजें हमारे पास है, इसका मतलब जो ये टॉर्क जनरेट करेगी वो भी हमेशा ज्यादा होगा. एंड इट इज अ वेरी 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 पोटेंशियल एक्सटेंसर ऑफ द कैपिटल एंड सर्वाइकल स्पाइन. ऑलवेज रिमेंबर दैट. ओके, चलो अब पढ़ लेते हैं कि ये क्या बात करते हैं. सबसे पहले trapezius is the most superficial amongst the posterior muscle. हम बात जानते हैं इस बात को. Trapezius spans from the occiput to the lower thoracic spine and contains a prominent tendinous region over this cervicothoracic region. सही बात है. The trapezius belongs predominantly to the shoulder region. However, when the upper extremities are fixated, जैसे कि मैंने बताया, अगर मैं शोल्डर को पकड़ लूं और पकड़ लूंगा तो it will cause extension at the cervical spine. They can produce extension of the head and neck. Always remember, it produces extension of the both head and neck, not only neck. Okay. Now, acting unilaterally, it can also cause lateral flexion and it can also cause lateral rotation on the contralateral side. ipsilateral side में तो ये करेगी, और अगर मैं ऐसे ले जाऊं तो और ये ऑपोजिट साइड का रोटेशन कराएगी बाय एक्टिंग एक्सेंट्रिकली. ठीक है ना? आप लोग सोच रहे होंगे कि भाई मसल तो इधर पड़ी है सारी, अगर मसल इधर है तो कंसेंट्रिक कॉन्ट्रैक्शन से ये कैसे उल्टी तरफ का रोटेशन करा सकती है? तो इट अलाउज द नेक टू रोटेट इनटू द ऑपोजिट डायरेक्शन बाय फायरिंग या बाय वर्किंग एक्सेंट्रिकली. ठीक है ना? तो कंसेंट्रिक कॉन्ट्रैक्शन से ये सेम साइड का लेटरल फ्लेक्शन कराती है और एक्सेंट्रिक कॉन्ट्रैक्शन से कॉन्ट्रालेटरल साइड का रोटेशन भी कराती है. ठीक है? तो इसका मतलब इट इज अ मसल विच इज एक्टिव इन ऑल द थ्री डायरेक्शंस, बट एक चीज मैं आप लोगों को बताना चाहूंगा कि अगर आप लोग देखें तो ऑल्दो इट हैज अ गुड अमाउंट ऑफ वर्क इन सजाइटल प्लेन, क्योंकि इसका मोमेंटम बहुत अच्छा होता है सजाइटल प्लेन में, ऑल्दो इसका फ्रंटल प्लेन में भी अच्छा मोमेंटम होता है। अगर मैं आप बीच से एक लाइन खींचूंगा तो इट जनरेट्स अ गुड अमाउंट ऑफ मोमेंटम इन द फ्रंटल प्लेन ऑल्सो, ठीक है। लेकिन जो टॉर्क जनरेशन फ्रंटल प्लेन में होता है वो हमेशा कम होता है एज कंपेयर टू द सजाइटल प्लेन। Okay, the torque which is being generated in the sagittal plane is always less than that of the torque which is being in the sagittal plane is always more than that of the torque generated in the frontal plane. All right, so always remember that. But it is one muscle which works in sagittal plane also, horizontal plane also, and your the other planes also. Okay, coming on to the other muscle, that is the levator scapulae muscle. Now, levator scapulae muscle is another muscle which comes a little deeper to that of upper trapezius. Okay, it is not as superficial as trapezius, लेकिन ये बहुत डीप भी नहीं है। इसका मतलब ये नहीं है कि इसका मोमेंटम कम हो गया और ये स्टेबलाइजर हो गई, बिल्कुल भी ऐसा नहीं है, ठीक है। In this case, this muscle is a very potential mobilizer only, but relatively the momentum of levator scapulae is little lesser as compared to the upper trapezius, ठीक है ना। और क्रॉस सेक्शनल एरिया की भी अगर मैं बात करूं तो इसका क्रॉस सेक्शनल एरिया हमेशा कम होता है एज कंपेयर टू दैट ऑफ दिस अपर ट्रेपेजियस, ठीक है ना। अब देखो, अगर आप इस पिक्चर में देख पा रहे हैं एफिशिएंटली, तो इट टेक्स इट्स ओरिजिन फ्रॉम C2 also, C3 also, नहीं सर, C1 also, C2 also, C3 also, C4 also. इन्होंने थोड़ा सा आगे भी किया हुआ है, लेकिन आइडियली ये C1 से C4 तक ओरिजिन लेती है फ्रॉम द ट्रांसवर्स प्रोसेसेस, एंड इट टेक्स इट्स इंसर्शन इंसर्ट करती है वहां जाके, इट टेक्स इट्स ओरिजिन फ्रॉम द सुपीरियर एंगल ऑफ द स्कैपुला, ठीक है ना। सुपीरियर एंगल ऑफ द स्कैपुला से ओरिजिनेट करके ये चलती है उल्टा इस तरीके से, राइट। दिस इज द रीजन व्हाई it has a responsibility of elevating the scapula. To be more precise, it has an action of elevating the superior angle of scapula more, ठीक है ना। ये जब कॉन्ट्रैक्ट करती है तो सुपीरियर एंगल ऑफ स्कैपुला इज यूजुअली एलिवेटेड, बट हाँ, क्योंकि इसका टॉर्क जनरेशन ज्यादा होता है तो अगेन इट कैन कॉज द एलिवेशन ऑफ द होल स्कैपुला एज वेल। अब बिल्कुल वही बात है, ये तो ओपन काइनेमैटिक चेन एक्शन हुआ, मैंने दोनों स्कैपुला को पकड़ के रख लिया नीचे। अगर मैंने दोनों स्कैपुला को नीचे पकड़ के रख लिया तो क्या करेगी, जब ये कॉन्ट्रैक्ट करेगी तो इट विल कॉज बायलैटरल एक्शन ऑफ लेवेटर स्कैपुला, विल कॉज एक्सटेंशन एट द सर्वाइकल स्पाइन, ठीक है। क्योंकि अगर दोनों ही मसल, ये मसल यहां से पुल करेगी, ये मसल यहां से पुल करेगी, तो रिजल्टेंट विल बी इन दिस डायरेक्शन, ठीक है ना। रिजल्टेंट फोर्स विल कम इनटू this direction, and this direction will be your extension of the cervical spine, ठीक है। अगर unilaterally function करे तो it can also cause lateral flexion ipsilaterally. in that context, अगर left side वाली करेगी तो left side वाली left lateral flexion कराएगी, right side वाली करेगी तो right side वाली right lateral flexion करा देगी, ठीक है ना। एक और बहुत इंपॉर्टेंट काम होता है इसका कि जैसे हमने शुरू में बात की थी कि लाइन ऑफ ग्रेविटी जो है, मैं वापस पीछे ले जाना चाहूंगा आपको, लाइन ऑफ ग्रेविटी जो है वो एंटीरियरली फॉल कर रही है। तो अब ये एंटीरियर जो एक्सटर्नल लोड पड़ा है तो वो हर वर्टिब्रा के ऊपर एक एक्सटर्नल एंटीरियर शेयर फोर्स एक्सर्ट करता है। ये इस पे यहाँ शेयर फोर्स कर रहा है, इस पे यहाँ शेयर फोर्स कर रहा है, इस पे यहाँ एक एंटीरियर शेयर फोर्स बिकॉज ऑफ दिस एक्सटेंसिव एक्सटर्नल लोड हमेशा लगता रहता है सर्वाइकल स्पाइन पे, ठीक है। अब ये एंटीरियर शेयर फोर्स जो है उसको काउंटरैक्ट करने का काम भी बायलैटरल एक्शन ऑफ लेवेटर स्कैपुला करती है। मतलब एक फोर्स जो कि अब इनको इस फोर्स को काउंटरैक्ट करते हुए इसको पीछे खींच रहा है, ठीक है ना। इट इज पुलिंग द वर्टिब्रास बैक, ओके। Now this shear force, the muscle which is responsible for the application of this shear force is your levator scapulae muscle, right? Now let us read what they have to say. Now, this levator scapula is deep to the trapezius. We all know that. It runs from the root of the spine of scapula and courses superiorly and medially and anteriorly to insert on the cervical transverse processes. This muscle has a large cross-sectional area, although it is lesser than that of the trapezius, but it has a larger cross-sectional area. The levator scapulae is a scapular elevator and downward rotator when the neck is stable, when the neck is not moving. Now, this downward rotator is the downward rotation of your scapula. It means it also rotates in this direction, right? Inward rotation. But if the upper extremity is stabilized, it will produce ipsilateral lateral flexion and rotation of cervical spine. अब आप एक चीज गौर से यहाँ देख सकते हो, अगर लेटरल फ्लेक्शन की बात करूं फिर से, अगर मैं बीच में एक लकीर खींचूं तो इसका मोमेंटम देखो आप, लेटर फ्रंटल प्लेन में भी इट हैज वेरी गुड अमाउंट ऑफ मोमेंटम. Fine, it is very fartherly located from the axis of rotation or from the center in the frontal plane also. Sagittal plane में भी अच्छा मोमेंटम है इसका, फ्रंटल प्लेन में भी अच्छा मोमेंटम है इसका. तो ये जितनी पोटेंशियल फ्लेक्स एक्सटेंसर है आपकी सर्वाइकल स्पाइन की, उतनी ही पोटेंशियल लेटरल फ्लेक्सर भी है. ठीक है. Although ये लोग कह रहे हैं that it has some actions in the horizontal plane also, so yes, it has better actions in the horizontal plane than your upper trapezius. Okay, इसका transverse plane में भी momentum अच्छा होता है because it is again fartherly located, क्योंकि transverse process पे जाके attach हो रही है. ट्रांसवर्स प्रोसेस ऑल्दो बहुत दूर है एक्सिस ऑफ रोटेशन से. ठीक है ना. वर्टिकल एक्सिस की अगर मैं बात करूं ट्रांसवर्स प्लेन में, तो इट इज away from the vertical axis of rotation also, so it produces good amount of torque for the rotation also. Right. Now, the levator scapula is optimally aligned to produce posterior shear force on the cervical spine. ठीक है ना. ये posterior shear जिसकी हम अभी बात कर रहे थे, which eventually counteracts the anterior shear force which is being employed because of the heavy weight of the head. क्योंकि हेवी वेट ऑफ द हेड जो है वो आगे गिर रहा है, आगे गिर रहा है, तो सर्वाइकल स्पाइन पे हमेशा एक आगे का फोर्स लगा रहता है, वो आगे एक पुल करता रहता है उसको. तो इस पुल को काउंटरैक्ट करने का जो काम करती है वो करती है लेवेटर स्कैपुले. राइट. Now, the cervical spine is subjected to constant anterior shear forces caused by gravity and the lordotic position of the spine in this region. The levator scapulae help to resist these forces. हम इतनी देर से जिसकी बात कर रहे थे वो यही लाइन है. Right? I hope it must be clear to you people. Now, an increase in the cervical lordosis is often seen in the forward-head posture, excessive forward-head posture. ठीक है ना. Will further increase the anterior shear forces on the cervical vertebrae and may cause overactivity of the levator scapulae to resist these excessive anterior forces. Right? अगर मैं forward head posture में हूं तो मेरा anterior shear और भी ज्यादा accentuate हो जाता है, और भी ज्यादा बढ़ जाता है, तो उसको counteract करने का काम या उसको resist करने का काम कौन करता है? levator scapulae. तो उस केस में हमेशा ऑलवेज रिमेंबर, उस केस में हमेशा लेवेटर स्कैपुले की एक्टिविटी बढ़ जाएगी. लेवेटर स्कैपुले की एक्टिविटी अगर बढ़ जाएगी तो हमेशा इट विल गो इनटू प्रोटेक्टिव स्पैज्म. इसीलिए जो पेशेंट्स आपके पास आते हैं, दे आर इनटू प्रोटेक्टिव स्पैज्म ऑफ द सबऑक्सिपिटल मसल्स आल्सो. अलोंग विद दैट दे आर इनटू प्रोटेक्टिव स्पैज्म ऑफ द लेवेटर स्कैपुले आल्सो. राइट. तो हमेशा याद रखिए कि वो लोग जो फॉरवर्ड हेड पोस्चर के हैं, या उन लोगों का जिनका फॉरवर्ड हेड पोस्चर है, उनका इप्सिलैटरल साइड, जिस तरफ की भी टाइटनेस है, जिस तरफ का भी स्पैज्म है लेवेटर स्कैपुला में, उनका उस तरफ का सुपीरियर एंगल ऑफ स्कैपुला विल बी एलिवेटेड एंड द स्कैपुला विल बी इन डाउनवर्ड रोटेशन. ठीक है ना. वो हमेशा आपको स्कैपुला अंदर मिलेगी. स्कैपुला का जो अबडक्शन के दौरान, शोल्डर अबडक्शन के दौरान जो आउटवर्ड रोटेशन होता है, उसका रेंज हमेशा कम होगा, कम मिलेगा आपको. ठीक है ना. तो दीज आर द गुड क्लिनिकली रिलायबल टेस्ट to see if your levator scapula is working properly or not. Fine. These are the muscles of the craniocervical region. So in the anterolateral region, we have sternocleidomastoid. It is again a big muscle, multi-articular muscles, right? It crosses various regions. It has scalene. So you have scaleneus anterior, scaleneus medius, and scaleneus posterior. We'll be talking about it in the coming slides. So now we have smaller, shorter muscles also, or you can call them as deep neck flexor muscles. They are longus colli. They are anteriorly located muscles. They are longus capitis. They are rectus capitis anterior. They are rectus capitis lateralis muscles. Right. Now the posterior muscles जिनकी हम बात करने वाले हैं, there will be splenius cervicis, splenius capitis, there will be rectus capitis posterior major, rectus capitis posterior minor, there will be obliquus capitis superior, obliquus capitis inferior. हम अभी आने वाली कुछ स्लाइड्स में इनके बारे में बात करेंगे. तो ये अगेन डीपर ग्रुप है, छोटा ग्रुप है, लिख दिया इन्होंने. डीप ग्रुप है. डीप ग्रुप है इसका मतलब मोमेंटम विल ऑलवेज बी लेस. इफ द मोमेंटम इज लेस, दे आर बेटर स्टेबिलाइजर्स, दे आर नॉट गुड मोबिलाइजर्स. राइट. They are superficial group. If they are superficial group, they have larger momentum. Okay. If they have larger momentum, they have larger, what you can say, torque generation. If they have larger torque generation, in that case, they will be good mobilizers. Right. Coming on to the other part, that is semi-spinalis capitis and semi-spinalis cervicis. Semi-spinalis capitis आप देख सकते हैं, इतनी ऊपर वाली मसल है, ठीक है ना. Semi-spinalis capitis is a wonderful muscle again, which is responsible for the production of. चलिए अभी हम देखते हैं, मैं पहले से बात नहीं करूंगा. Let us see what they have to say about it. Now they run from the occiput to the cervical spinous processes. Okay, occiput से शुरू हुआ, spinalis capitis, and it has come to the spinous processes. Okay, and they can also generate from the spinous. The semispinal cervicis starts from the spinous process of the cervical spine, and they end on the transverse process of the thoracic spine. Right. So these are the muscles responsible to produce extensive extension at the head and obviously the cervical spine. Now the splenius capitis and splenius cervicis muscles are deep to levator scapulae. मतलब अब ये deep to levator scapulae है, इसका मतलब इनका momentum with respect to या in comparison to the levator scapulae will always be low. अगर लो होगा तो torque generation भी in comparison to these levator scapulae will always be lesser. तो इसका मतलब they will not be as potential mobilizers as your levator scapulae. Right. Now these splenius muscles are large, they are flat, and they run from the spinous process of the cervical and thoracic spine to the ligamentum nuchae. Ulti chal rahi hai, right? It is going like this, right? So it is going like this here. These muscles serves as prime movers of the head and neck as a result of their larger cross-sectional area. Although momentum अगर इनके पास ज्यादा नहीं है, इनके पास cross-sectional area ज्यादा है. आप देख सकते हैं कि although यहाँ ये fibers जो medial fibers हैं, they are more at center, but the lateral fibers are extending quite laterally. इसका मतलब इनका जो lateral fibers हैं, उनका frontal plane में भी momentum ज्यादा है. इसका मतलब अगर lateral fibers work करें तो they can also work for lateral flexion. All right, the lateral fibers of semispinalis capitis can also work for lateral flexion of head, and that of the semispinalis cervicis can also act. क्योंकि अगर यहाँ से एक attachment है इनका, तो अगर यहाँ से देखो तो it again has a good amount of momentum in the frontal plane. So in that case, they can be good side flexors of the neck in case of frontal plane stabilization, frontal plane motions, right? So and has larger momentum. ठीक है ना, momentum भी इनका अच्छा खासा होता है. Now they produce extension. Just a second. They produce extension when working bilaterally and ipsilateral rotation while working unilaterally. So again, one more important thing हमको पता चली कि ये muscles rotation भी produce कर सकती हैं, right? They are the muscles that can also lead to rotation of the cervical spine, right? Wait, let me just. Yeah. Now this is a depicting picture of the semispinalis capitis. सब जने काम करेंगे. Everybody who's looking at me, अपने सिर के पीछे हाथ रखो and push it back. Hold it. Isometric करने की कोशिश करो. Extensors की, right? Push your head back on your arm, on your hand. Okay. And now try to palpate. दो फिंगर लो और palpate करने की कोशिश करो posterior aspect of neck पे. क्या आपको ये दो folds महसूस होते हैं? If you can feel those two folds, it means you can easily palpate the semispinalis capitis. The two folds that you can palpate is nothing but your semispinalis capitis. Everybody of you do that and write it in the comment box if you can easily palpate the folds of semispinalis capitis. Do that. कुछ नहीं करना है, हाथ पीछे रखो and stabilize it here and push it back and push your head back. Okay, and try to palpate the folds of semispinalis capitis, right? You'll be easily able to palpate the folds of semispinalis capitis. Do it everybody. Come on, करो और फिर मुझे बताओ. If you can easily palpate it. Is it palpable? Okay. I can see. Yes. Very good if it is palpable. Good. I wanted you to palpate this. You can see it, the span of the muscles, you can see it in this picture. The man who is rotating, see, these are the lateral fibers which are going quite laterally, giving you frontal plane momentum as well. Fine. Great. Very good if you can palpate. Very nice. Coming on to the other group of muscle. Now this muscle is a part of your erector spinae. We'll be talking about erector spinae once we'll be talking about the lumbar spine. Okay, lumbar spine ki biomechanics mein I'll be telling you about the erector spinae muscles. Okay, now we'll be talking about the two erector spinae muscles. These are longissimus capitis and longissimus cervicis. Now the characteristic feature of the longissimus is that longissimus is a little lateral to the axis of rotation. Anyways, by physiological position of this muscle, it gives you some amount of frontal plane momentum. Right? Let us see what they have to say. Now, longissimus capitis and longissimus cervicis are deep and lateral to the semispinalis group. Okay. Now they come lateral also and deeper also. Deep आ गई इसका मतलब sagittal plane में momentum इसका अपने आप कम हो गया. Momentum sagittal plane में कम हो गया तो sagittal plane का torque जो है वो भी अपने आप कम हो जाएगा compared to the previous muscles. Right. Now their deep position place them close to the axis of rotation for flexion and एक्सटेंशन जिसकी कि मैं बात कर रहा था. ठीक है ना. अब अगर ये क्लोज टू द एक्सिस ऑफ रोटेशन आ गए हैं sagittal plane में फ्लेक्शन एक्सटेंशन की, इट मींस इट दे विल नॉट बी पोटेंशियल मोबिलाइजर्स फॉर द एक्सटेंशन ऑफ द सर्वाइकल स्पाइन. इसका मतलब ये एक्सटेंशन के लिए उतना पोटेंशियल टॉर्क जनरेट नहीं कर पाएंगे जितना प्रीवियस मसल्स कर रही थी. इसका मतलब दे हैव स्मॉलर मोमेंटम, स्मॉलर टॉर्क, तो they will be good stabilizers but they will not be good mobilizers. ठीक है ना. Rendering them ineffective extensors because of their small momentum. Always remember this particular thing. ठीक है. Now the lateral position allows them to produce ipsilateral lateral flexion when working unilaterally, and when working bilaterally they serve for frontal plane stabilizers of the cervical spine. Right? अगर एक तरफ की काम कर रही है तो it will pull it in this direction. अगर right side की कर रही है तो right side का lateral flexion करा देगी, और अगर दोनों side की कर रही है तो extension तो produce नहीं कर सकती, लेकिन it will stabilize the neck in frontal plane. मैंने शुरू में आपको बात कही थी ना कि in the whole space में जो मेरा हेड का अलाइनमेंट है वो भी काम नेक की मसल्स करती हैं. राइट. तो इन दिस केस मेरा सिर इधर नहीं गिर रहा है, मेरा सिर इधर नहीं गिर रहा है, ऐसे एक जगह पे स्टेबल है. अगर मेरा सिर एक जगह पे स्टेबल है या नेक्स्ट एक जगह पे स्टेबल है तो मेरी बायलैटरल लॉन्गिसिमस कैपिटस जो है वो वर्क कर रही हैं, व्हिच आर इवेंचुअली हेल्पिंग माय नेक टू बी स्टेबलाइज्ड इन द फ्रंटल प्लेन. राइट. एंड प्रिवेंटिंग द फॉल इन एनी डायरेक्शंस, राइट और लेफ्ट. ओके. नाउ द ओके हमने बात कर ली इसकी. Coming on to one of my favorite group of muscles, that is the suboccipital muscle. Suboccipital muscles पे मैं पढ़ाने से पहले आपको कुछ दिखाना चाहूंगा. Look at this picture, right? This is the occipital protuberance area. Fine. This is the occiput. This is C1. This is C2. Okay. Now this one is C1. Okay. This one is C1 and this one is C2. Fine. You can see the larger transverse processes here. Now this is a superficial muscle and a larger muscle which crosses the occipital protuberance and gets attached onto the spinous process of the second cervical vertebra. This is the rectus capitis posterior major. Fine. There is a deeper muscle which is a shorter muscle which again starts from the occipital protuberance and gets its attachment onto posterior tubercle of the C1, which is known as rectus capitis posterior minor. Now this muscle acts as generates very small torque for the extension of the C0 C1 joint. Now rectus capitis posterior minor is the only muscle which is responsible for extension of the head or the C0 C1 joint. Although it is the rectus capitis posterior major is a superficially lying muscle as compared to the minor muscle. It has relatively larger momentum as compared to that of the minor muscle. It can also generate some amount of torque, which can be helpful for the extension of C0 C1 also and C1 C2 also, because it crosses both the segments. It is a biarticular muscle, right? So these are the two muscles which are specifically meant for the extension of C0 C1 and C1 C2. Now they are quite closely related to the midline also, and they produce these action by working bilaterally. All right. Now talking upon the other muscle, this is the rectus capitis obliquus superior or obliquus capitis superior muscle. Now this muscle is relatively laterally located. If you can see, if this was the frontal plane midline, so and this is the perpendicular from here. So this is the perpendicular distance of the this particular muscle. So it has a larger momentum for in the frontal plane. Okay. So in this case, this muscle can help for lateral flexion of C0, C1, right? Lateral flexion of C0, C1 can be done because of this. Okay. On the contrary, the muscle, the counterpart of this muscle, that is rectus capitis obliquus inferior, it runs between C1 and C2 quite obliquely. You can see the this variation and this angulation of the fibers. The angulation of the fibers here is too much as compared to somewhere here, right? So it is quite vertical, the obliquus capitis superior, but the obliquus capitis inferior is quite oblique. Okay, it has very greater momentum. Very greater angulation. Now this is a muscle that runs between C1 and C2 and eventually helps in rotation of the C1 C2 segment. हम लोगों ने शुरू में बात कही थी कि the 50% of the total rotation at the cervical spine occurs at C1 C2 segment. Now this muscle is one which is exclusively working to produce rotation of the C1 C2 segment. ठीक है ना? अगर इप्सिलैटरल, अगर लेफ्ट साइड की ऑब्लिकस इंफीरियर काम कर रही है तो आई विल बी रोटेटिंग ऑन द लेफ्ट साइड. राइट साइड की ऑब्लिकस इंफीरियर काम कर रही है तो आई विल बी रोटेटिंग ऑन द राइट साइड. राइट. आई होप आप इन चारों मसल्स का काम समझ चुके होंगे. दिस इज द ऑब्लिकस इंफीरियर. इफ यू कैन सी दैट, दिस इज हाउ. अगर ये इस तरफ कर रही है, if this is contracting, it is rotating on this side. If this is contracting, this is rotating on this side. Okay, right side produces contraction, the rotation on the right side. Left side contraction produces rotation on the left side. Let us see now what these things has to say. The suboccipital muscles consist of rectus capitis posterior major, minor, inferior obliquus, superior obliquus muscles, and are deepest of all. ठीक है ना? Always remember they are deepest of all the other muscles that we have talked about. अब तक हमने जितनी चीजों की बात की है ये उन सब से deepest है. They run between the occiput and C2. कुछ होती हैं जो occiput से C1 तक आती हैं, कुछ होती हैं जो occiput से C2 तक आती हैं, कुछ होती हैं जो C1 से C2 तक आती हैं. हमने अभी देखा. Allowing independent movement of the craniovertebral region on the lower cervical spine. Together, they produce occipital extension when they are working bilaterally and together. All of the muscles are working together and bilaterally, they'll produce extension at the cervical spine. क्योंकि छोटा छोटा torque सबका मिलाकर के एक बड़ा torque develop होता है. Eventually, that causes extension of the upper cervical spine, including the craniocervical region, I would rather say. Unilaterally, they produces ipsilateral rotation and lateral flexion. ठीक है ना? Since they have small cross-sectional area, they may also serve primarily as a proprioceptive role in the form of stabilizers. ठीक है ना? तो ये stabilizer की तरह भी काम कर सकती हैं, लेकिन अगर in case जहाँ पे सिर्फ exclusively मुझे सिर्फ कैपिटल एक्सटेंशन की जरूरत पड़े या क्रेनियोसर्वाइकल रीजन के एक्सटेंशन की जरूरत पड़े, these are the muscles that work conjointly together with each other and produces a good amount of torque so as to produce that particular motion of extension. Right, that we have talked about already. Now this is the combined action of all these muscles. If you can see that, always see the direction. See the obliquus capitis superior has direction, this direction. Now this is again another muscle, that is rectus capitis posterior major, this direction. Minor, this direction. Again rectus capitis posterior major, this direction. This is again superior, obliquus superior, this direction. This has to be rectus capitis lateralis here, this direction. Rectus capitis lateralis, this direction. This is obliquus inferior, this direction. This is obliquus inferior, this direction. This is your semi-spineless cervicis, this direction. So eventually, ये सारी muscles जो हैं, इनका direction चाहे ऐसे हो, चाहे ऐसे हो, चाहे ऐसे हो, चाहे ऐसे हो. मतलब if they are coming from either farther away or close to the midline, they are eventually, the force is directed inferiorly only. Fine. Their force is directed inferiorly. Okay. Okay. So the resultant will be coming inferiorly only. Okay. Vertically inferior, causing extension of the cervical spine. Fine. I hope that must be easier by now. अब ये समझ में आ जानी चाहिए चीज. So it is a comprehensive chart of the action of the muscles that which is being taking place here. So rectus capitis posterior major, it works on the atlanto-occipital joint, rectus capitis anterior muscle, and causes flexion. It can sometimes also cause lateral flexion, but it is a poor lateral flexor. Okay, if it is 1x, it means it is a poor mobilizer of that muscle. If it is 2, it means satisfactory. Okay, it can produce some amount of torque. Okay, if it is 3 crosses or 3x, it means it is an excellent mobilizer of that particular muscle, of that particular region, or that particular movement. Rectus capitis posterior, rectus capitis anterior does not have any action on the atlantoaxial joint. It means it spans between C0 and C1 only, right? So rectus capitis lateralis is just meant for lateral flexion. That too, it is a satisfactory lateral flexor. It has no action onto your atlantoaxial joint. So this also spans between C0 and C1 joint only. Now coming on to rectus capitis posterior major, it spans from C0 to C2. So it is a very potential, excellent extensor of the C0, so in atlanto-occipital also and atlanto-axial also. So it works on C0, C1 also. It works on C1, C2 also. It is a satisfactory lateral flexor also because of its lateral alignment, okay, or the lateral fibers of it. And it can also cause satisfactory ipsilateral lateral rotation also. Fine. Talking about rectus capitis posterior minor, rectus capitis posterior minor is a satisfactory extensor of the atlanto-occipital joint. It also spans between only C0, C1 joint. And it can also at times poorly be your lateral flexor. It is not an excellent lateral flexor and has no action onto C1, C2 joint, right? Obliquus capitis inferior, it runs between C1, C2 and therefore it does not have any action on C0, C1. It has, if working bilaterally, it can cause satisfactory extension at your C1, C2 joint, okay? And it is a very excellent ipsilateral rotator of the C1, C2 joint, as I told you that. Fine. Obliquus capitis superior muscle spans between C0 and C1 joint only, okay? And working bilaterally, it is an excellent extensor and it is an excellent lateral flexor also, more than that of the rectus capitis lateralis, okay? So it can be an excellent lateral flexor of the upper cervical spine, and that too C0, C1 only, and extensor of the C0, C1 joint. Fine. So this sums it up and makes it quite easier for you people also to understand this particular thing, right? Coming on to the other muscles of the lateral compartment, now scalene is another larger muscle that comes to us. Scalene has 3 parts, that is scalenus anterior, middle and posterior, right? They are eventually meant for they attaches onto the siomastoid process in their insertion, and they takes their origin from the first rib and the second rib also, right? Now the scalene muscles are located onto the lateral aspect of the cervical spine and serve as frontal plane stabilizers, okay, specifically into the frontal plane, along with the longissimus muscle posteriorly when they are acting as a group. Now, anterior scalene muscle, which runs from the first rib to the anterior tubercles of the cervical transverse process of the C3 to C6, works with the levator scapulae to provide stability. Anterior scalene muscle, when working bilaterally, will flex the cervical spine because it is anteriorly located. It is located anterior to the mediolateral axis of rotation. That is why while working bilaterally, it can cause some amount of flexion of the cervical spine. Unilaterally, anterior scalene muscle will produce ipsilateral lateral flexion because they have good amount of momentum and sometimes contralateral rotation also, but they are potentially meant for ipsilateral lateral flexion only. Middle scalene, on the contrary, the middle scalene runs from the first rib to the anterior tubercle of the transverse process of C3 to C7. Now, middle scalene muscles are more laterally placed than are the anterior scalene. मतलब ये अब थोड़ा सा पीछे आ गई हैं, इसका मतलब इनका bilateral action भी होगा तो कभी भी ये flexion produce नहीं करेंगे, okay? And their line of pull makes them excellent frontal plane stabilizers. अगर दोनों काम कर रही हैं मसल साथ में, bilateral action will be a good frontal plane stabilizers. The posterior scalene muscle runs from the second rib to the posterior tubercle of the transverse process from C3 to C7. The posterior scalene muscles predominantly are the lateral flexors of the neck, okay? So here you can see the anterior scalene, here you can see the middle scalene, and here is the posterior scalene, if you can see it here, right? So the maximum work, maximum action of the lateral flexion of the neck is being done only and only by your this muscle, okay, posterior. Coming on to the other muscle, again a wonderful muscle. It is a sternocleidomastoid. Sternocleidomastoid is one very different muscle which acts not only, which is not only a multi-articular muscle, but it is a multi-planar muscle also. For the lower cervical spine, it is anteriorly located. If you can see the lateral view, or if you can even palpate it, you people know that it takes its attachments from clavicle also and sternum also. So it runs from here slightly, if you can see that, and it goes posteriorly then to attach onto mastoid process. So the axis of rotation or the line of the pull of this muscle lies posterior to the upper cervical spine, but at the same time its line of pull lies anterior to the lower cervical spine. अब अगर जिनके जहां जहां पे पोस्टीरियरली लाई कर रहा है इसका लाइन ऑफ पुल, तो इट विल बी एन एक्सटेंसर फॉर दैट कंपार्टमेंट, एंड जहां जहां पे इसका लाइन ऑफ पुल एंटीरियरली लाई कर रहा है सर्वाइकल स्पाइन पे, इट विल बी अ पोटेंशियल फ्लेक्सर फॉर दोस कंपार्टमेंट. सो यू कैन से दैट this particular muscle is a muscle which causes extension at the upper cervical spine and flexion at the lower cervical spine. इसका मतलब extension at the upper cervical spine and flexion at the lower cervical spine like this. This is your forward head posture. If you can visualize me, it is a forward head posture. ठीक है ना? Forward head posture also includes extension of the upper cervical spine and flexion of the lower cervical spine, right? So this is the beauty of this particular muscle. You can easily palpate it. Here is this muscle, okay? Apart from this, it also has actions in the frontal plane alignment also. It has actions in the horizontal plane alignment also. So let's see what they have to say. The SCM is one of the most prominent muscle of the anterolateral compartment of the neck. Inferiorly, it attaches to the sternum and clavicle, running obliquely and superiorly to a thin line extending across the mastoid process. Acting unilaterally, it causes a lateral flexion and opposite rotation, and working bilaterally in sagittal plane, it causes movement at the craniocervical region. ये सारी बात हम लोग कर चुके हैं. Okay, so this becomes easier for you people. Coming on to that part कि शायद मुझे लगता है कि इससे पिछली मसल्स तो फिर आप लोगों ने कभी ना कभी सुनी होंगी, बट एंटीरियर कंपार्टमेंट की मसल्स जो है उनकी बात बहुत कम लोग करते हैं. Let us talk about a few muscles of the anterior compartment also. So the major muscles that we'll be talking about includes longus colli and longus capitis. As you can see here, longus capitis are the muscles that originates from the transverse process from the anterior part, obviously, and they get attached to the anterior portions of the skull, okay, of the occiput rather. Okay, and they are also quite deeper muscles. When you try to palpate it anteriorly, eventually you can easily palpate it from the anterior triangle of the neck, right? From here you can palpate it. Okay, now, and that of the longus colli reaches till C1. It doesn't continue till C0, so it cannot be a flexor of C0 C1. Eventually it is a flexor of C1 C2 and rest of the spine also. So these muscles are located deep to the esophagus and trachea. So they are quite close and they have lesser momentum. Now these muscles primarily work from anterior vertical stability. Longus colli contains multiple fascicles arising from the anterior vertebral bodies of the first thoracic spine and all the cervical vertebrae extending to the anterior tubercle of the transverse process and the anterior arch of the atlas. Okay, that is the longus colli, which eventually works for the flexion of the cervical spine. Anterior fibers of longus colli works to flex the neck, and lateral fibers work to stabilize the neck vertically, right? तो इसका मतलब ये laterally भी जा रहे हैं और frontal plane stability के लिए भी ये लोग काम कर रहे हैं. Now, on the other hand, the longus capitis arises from the anterior tubercle of the transverse process of the mid to lower cervical vertebrae and attaches to the basilar part of the occipital bone. That is what I was talking about. So in this case, if there is some amount of flexion or that is nodding, which this muscle has to provide, but it is very deeply located muscle, so it is a better stabilizer. It is not a good mobilizer. यही next line में भी लिखा है. Its primary action is to stabilize and fix the craniocervical region, right? Talking on to the rectus capitis anterior and rectus capitis lateralis. Both the muscle arises from elongated transverse process of atlas vertebra and continues to insert on the inferior surface of the occipital bone. Both the muscles are helpful in sagittal plane stability. Rectus capitis anterior is a thin muscle helpful in capital flexion, and rectus capitis lateralis is helpful in lateral flexion. All right. So these are the muscles which are also responsible for lateral flexion and capital flexion also. So here you can see these are small muscle. This small muscle is a rectus capitis anterior, and this small muscle, which has good amount of frontal plane momentum, it can work for lateral flexion also. Although both these muscles work only for C0, C1 joint, that is your atlanto-occipital joint only. Now this is the craniocervical kinematics. Craniocervical kinematics includes your protraction and retraction. Protraction is very synonymously word used for your forward head posture. So protraction always leads to extension of the upper cervical spine, okay, of upper cervical spine, and flexion of lower cervical spine. Okay. Similarly, retraction causes flexion of upper cervical spine and extension of lower cervical spine. Okay, so the muscle which is primarily responsible for this is your SCM, that is your sternocleidomastoid, right? I told you that it attaches over here and it continues to like this. Okay, so when this contracts, it causes extension of this particular region and flexion of this particular region. Fine. There are n number of muscles which are responsible for this. Fine. Especially your deep neck flexor muscles are responsible for this particular thing to happen. Okay, so I think this is also quite clear for you people by now. Now this comes for the calculation of the joint reaction forces at C7 and T1. Probably this is the last segment that we'll be talking about today. But trust me, this analysis of forces is very, very, very important with respect to your clinical insight also, and with respect to your biomechanical insight also, right? Suppose for an example, if we take a person of say 120 pounds, right, 120 pounds somewhere nearly brings out to be 534 Newton. Okay, this is the body weight of an individual. We'll be considering, we'll be taking, making all the calculations according to this particular figure. Okay, so suppose this lady has this particular weight, and let us try to calculate. Now, if we know that I'm standing in this particular region, in this particular manner, see, if I am also sitting like this, my head is not falling forward, my head is not falling backward, it is not going either ways. We'll be trying to calculate the forces in the striatal plane only, right? So if it is not falling forward, it is not falling backward, it means it is stabilized. It is into static stability. It is into static equilibrium. So I can consider that the head and neck are in static equilibrium. Okay, so I can say that in static equilibrium, all the forces which are acting on the particular region, because we are calculating it from C71, so all the forces which are acting on C71 are equal and opposite in direction, such that the resultant force is zero, nullified, right? If it is like that, in this case, we all know that external torque must be equal to internal torque, correct? Everybody agrees to this? Okay, this is the primary thing of static equilibrium, right? Static equilibrium, external torque is equals to internal torque. If external torque is equal to internal torque, we know the formula of torque. What is the formula of torque? Is force into momentum. Here also force into momentum. Now what happens is, from the normal cadaveric calculations also, and from the arbitrary values, we always take that the weight of the head is considered to be 7% of the body weight. Now what is the 7% of 534 newtons? Can you people calculate and tell me? Can you people calculate and tell me? So it is somewhere about 38.4 Newton, right? 7% of 534 Newtons comes out to be 38.4 Newtons. Rather, it comes out to be 38.37 Newtons. So I'm taking it as 38.4 Newton. No problems with this? Okay. Now, by this picture or by cadaveric calculations only, we know that the axis of the external momentum because of the weight of the head comes out to be somewhere 0.04 meters, and that of from the attachment of the extensors of the cervical spine comes out to be 0.02 meters for at the C7T1 angle, right? So here I can write it as external load. This F is FEL, external load. This is the momentum of the external load. This is the force of the muscles. This is the momentum generated by the muscles or the extensors, right? I can keep it as extensors also. Fine. So the force of this is the external load. We know that this is 38.4. The external load momentum, we know that 0.04. Here we don't know the force which is being exerted by the extensor muscle. So we'll keep it as FE. And this also we know that 0.02. So isko idhar se kata, we'll get 2. So what happens is force of the extensors is equals to somewhere around 76.8 Newton. Correct? So it becomes somewhere equal to 76.8 Newton. It means the force which is being exerted by the extensors at C7T1 is nearly 76.8 newtons. It means it is double to that of the force which is being exerted by my head. अगर मेरा head जितना amount of force नीचे exert कर रहा है, उसका double work करना पड़ रहा है मेरी muscles को, right? It has to work double here. Now we all know that this particular force is being directed vertically downwards. The weight of the force is also the external load is also vertically downwards, but there is one force which is directed vertically upwards, which is in the opposite direction. Okay, now this opposite direction is the joint reaction force. So I can eventually say, we all know that we are into static equilibrium. If we are into static equilibrium, it means all the forces which are acting at a particular segment are equal and opposite in nature, right? So I can write it as force JRF minus force of the extensor muscles minus force of the external load will be equals to 0. Fine. Will that be okay? Or I can also write as force joint reaction force is equals to force of the extensors of muscle plus force of the external load, right? So we know this value 76.8 plus we know the value 38.4. So what does it comes out to be? 2, 1, 14, 5. Okay, one more 10, 1, 1, 5. So the total amount of force which is being or the total amount of compressive force existing between C7 and T1 joint, one single segment, is nearly equal to 115 Newton. Suppose the similar sort of force is existing between all the 7 segments. So can you calculate this? 115.2 into 7, although it can be variable at different segments, but I'm just taking an example of it, right? So what happens is this is 4, 1, 35, 36, 7, 7. So it is nearly 776.4, which is eventually even more than the total body weight, right? So the force which exists, the compressive force, while just keeping my head erect, the compressive force which is eventually existing between your cervical spine, the segments, the joints of the cervical spine, accentuates, even it is more than that of the total body weight of an individual. Now what happens is, if I increase this force, if eventually by any means this force is increased, the joint reaction force will also increase. So or just remember one thing, whenever the patient comes to you for cervical spondylosis or for any ailment of any neck ailment, what do you prescribe to them on the first go? क्लिनिकल इनसाइट बता रहा हूँ, गौर से सुनना। आप सबसे पहले क्या प्रिस्क्राइब करते हैं, या हमारे पास कोई भी सर्जन के यहाँ से जो लिखा हुआ आता है, क्या लिखा आता है? सर्वाइकल आइसोमेट्रिक्स। सर्वाइकल आइसोमेट्रिक्स से मैंने क्या किया? इस फोर्स को मैंने इंक्रीज कर दिया। अगर सर्वाइकल आइसोमेट्रिक्स में करा रहा हूं, दम लगा करके पेशेंट धक्का मार रहा है पीछे, तो इवेंचुअली क्या हुआ? एक्सटेंसर्स ऑफ द फोर्स ऑफ द एक्सटेंसर मसल विल इवेंचुअली इंक्रीज बाय द एक्शन ऑफ आइसोमेट्रिक एक्सरसाइज. इफ दिस वैल्यू इज इंक्रीजिंग, this value here is also increasing. If this value is increasing, eventually the joint reaction force or the compressive force which is existing between each joint will increase. सोचो वो कितना बढ़ जाएगा अगर मैं हर एक joint का calculate करने बैठूंगा तो, right? So I always prescribe one very small thing, one very clinically insight sort of thing to you people, that always try to go for mobilizations, try to go for eccentric training of these muscles. Eccentric training in fact deload कर देगी, ठीक है ना? eccentric training करेगी तो इसका जो डायरेक्शन है वो उल्टा हो जाएगा, डायरेक्शन उल्टा होते ही ये प्लस चला जाएगा, ये प्लस चले जाएगा तो वहां जाके नेगेटिव हो जाएगा और इवेंचुअली जेआरएफ को रिड्यूस कर देगा, right? If I'm doing eccentric work, the action will eventually turn to, the direction will change to this. If direction will change, this value here will become positive. If it is going beyond opposite to that, this what you can say equals to mark, it will become negative. If it is becoming negative, this value will eventually reduce. Okay, this is the reason why it is always prescribed to go for eccentric training of the cervical extensors rather than going for concentric training of these muscles. I hope that was beneficial for you people. Now we'll be trying to go for the questions if they are. If you people have any questions, I request you please to write it on the comment box. And please also tell me how the session went for you people. How was the session? Please tell me. It was eventually a good one for me. Let me check. Okay, ipsilateral side elevation by levator scapula. Yes, they can do that. Yes. If we talk about the ipsilateral side elevation of scapula, yes, they can do that. Any more questions do we have here? Thank you so much for your valuable feedbacks. I would rather appreciate if you can ask any question. If you do have any questions, please do ask me. If you have any question, you can write it in the comment box. Thank you so much for your such wonderful feedbacks I'm getting on the comment box. Thank you so much. Please, if you have any question, you can write it. If you have any question, you can please write it here. How to do stabilization training for cervical spine? Okay, you mean to ask about the eccentric training, right? So what you just have to do is just make the patient lie in the supine position. Ask the patient to go chin tuck. If the patient is going into chin tuck, the length of the extensors will eventually increase. Ask the patient to then press the head down such that it will be a controlled neck exercise, lengthening neck exercise, right? It will be a eventually an eccentric training exercise for your particular extensor group, right? So this is how you can perform it. Fine. If you have any more questions, you can please ask it to me right now. I'll be here for say a few seconds more. We can talk about it. Nayanika, I hope I'm clear to you, your answer. Is it fine for you? The answer that I have given you. So any more questions? If you have any more questions, I'll be staying here. Otherwise, we'll be leaving it for now. If you have any more questions, please, anybody. If you have any more questions. More questions. Okay, that's great. Fine. So if you do have any questions further later also, just go through the video once again. If you have any more questions, you can do contact me on any sort of social media. You can WhatsApp me, you can Facebook me, you can write it on the Telegram, you can mail it to me. You can send your questions by any means. Okay, I'll always be there to help you out for any such related queries. If you have any other queries also related to your any cases, related to any protocols, any physiotherapy maneuvers, if you want to discuss any case with me, you are most welcome. You can just send me the reports if you want to. Will resistance training help? No, not at all. By doing resistance training, you are eventually causing increased contraction for concentric contraction of the extensor muscle. So no resistance training, please. Okay. So if you want to discuss any case here, you can priorly send me the reports. If you have any x-rays you want me to take it here, you can definitely do that. Okay, so this is all for today. Thank you so much everybody for being here. Please do, I'll be putting a quiz about this probably tomorrow or day after tomorrow on the Telegram channel. Please do attempt that quiz, and I can see that you people have started attempting the previous quizzes also. Please do that, and I'll be compiling the links of all the other quizzes and I'll be sending it on to the Telegram channel only. So please do keep watch on that. Please do attempt it. It's for your betterment only. Thank you so much for sparing time on the Sunday. I'll catch you on the next Saturday and Sunday. Thank you so much. So till then, stay home, stay safe, and stay healthy.